Thank you. Thank you, Anders. Thank you, Nikolai. And thanks for inviting me to give the introductory lecture to you this morning. So let's see if we can bring up the right presentation first. So this is not the right one. So we should click down this one here. Looks all right. See if we work with this one. The dose makes the poison. This very true observation was made by Paracelsus, the father of toxicology, already in the 16th century. So mere presence of a chemical doesn't mean that there is an effect. And pharmaceuticals are indeed present and widespread in the environment. We even find some of them far out at sea. And presence may of course be perceived as a problem in itself, but the critical question is if the concentrations are high enough to cause effects of concern. So in tap water, we can often detect a few selected pharmaceuticals up to very low nanogram per liter concentrations. Although risks can, from a theoretical standpoint, never be completely excluded, nothing really indicates that the levels present in drinking water is a cause of concern. Surface waters contain more pharmaceuticals at high concentrations, up to a microgram or perhaps a little bit more for a few compounds. Inside of sewage treatment plants, concentrations are often 1 or 2 orders of magnitude higher. But here we are not concerned about effects on any higher organisms within the plant. But there is a potential risk that antibiotics inside the treatment plants could promote antibiotic resistance inside the plants. And then finally, in environments polluted by industrial discharges, concentrations can be much, much higher and reach well into the milligram per liter range. And these differences are of course fundamental when it comes to understanding and managing risks. So I was asked to talk today about how big the problem is with pharmaceuticals in the environment. And I have to disappoint you to say that it is quite a difficult question to answer. And one reason is that exposure data is lacking for many active pharmaceutical ingredients, particularly in high-risk environments such as near manufacturers. The perhaps most relevant toxicity data is lacking for the great majority of drugs. In fact, we often do not know what effects to expect or suspect from a given pharmaceutical. And we know quite little about how to assess mixture effects. Add to that there is limited surveillance data of wild animal populations, particularly aquatic animals. And when we do see health issues with wildlife, most effects that we see could have multiple causes. And this means that unless effects are quite dramatic, we often do not spot them. And even if we do, we often don't understand what is causing them. However, the almost complete population collapse of several species of vultures in India and Pakistan, that was difficult to miss. But it took quite clever research to figure out that this was caused by exposure to a chemical, diclofenac. This may in fact be the most severe example of a population collapse where we clearly can link it to exposure to a single chemical. And it surprisingly turned out to be a pharmaceutical. The feminization and reduced fertility of fish downstream from sewage treatment works is another example where we are pretty certain that ethyl estradiol from contraceptives is a major contributing factor. In this case, we also have concurrent exposure for considerably less potent estrogenic compounds. Feminization of fish is well characterized in the United Kingdom, but much less so in Swedish waters. Another related group of pharmaceuticals are synthetic gestagens. At least one of these, levonorgestrel, is as potent as ethyl estradiol. Fish swimming in undiluted, treated Swedish sewage effluent accumulate levonorgestrel in their blood to concentrations similar to those as you find in the blood of a woman taking contraceptives. And as little as 1 nanogram per liter can stop reproduction in fish. We sometimes find this concentration in treated sewage effluents here in Sweden, but reliable measurements of levonorgestrel in surface water is almost completely lacking. A couple of years ago, we learned from researchers in Umeå that oxazepam, the active substance in, for example, Sobril, could affect the behavior of perch at around those concentrations that we find right here in the river Fyrisån. But whether the behavior of actual wild fish is affected, we do not know yet. One thing we do know is that direct discharges from manufacturing of pharmaceuticals can have devastating effects on the environment. Here, we have no animals left to study in the water because it's too toxic for them. But multi-resistant bacteria thrive here as never before. This environment in India is, to my best knowledge, the most extreme environment described on Earth in terms of multi-resistance to antibiotics. A typical bacterium here is resistant to 30 out of 39 tested antibiotics. Some are resistant to basically everything. We've also shown that bacteria from industrially polluted lakes are very good at transferring their resistance to other bacterial species, including pathogens. These factories produce many of the drugs that we are using here in Sweden. So I'm therefore glad that there will be considerable focus on managing manufacturing discharges at this meeting. Some pharma companies are eager to point out that the total mass flow to the environment is most likely considerably larger from usage than from manufacturing, simply because use is much more widespread than our production sites. This may be used as an argument to prioritize discharges from usage and excretion. For carbon dioxide and some very persistent chemicals, it is indeed the sum of all discharges to the environment that determines the risk. But the fact is that this is not true for pharmaceuticals. They do not act like carbon dioxide. They do not persist for decades and accumulate in polar bears. More than 15 years of research has consistently showed that risks are largest when concentrations are sufficiently high near where the pharmaceuticals are discharged. And I will have 15 minutes to talk and 5 to speak, so I have a little bit more. I discussed this before with others, so you don't need to wait more. Thanks. So, I therefore again would like to remind you about the concentrations from different sources. This illustrates the concentrations of ciprofloxacin of an antibiotic commonly found in sewage effluent below or measured in industrial treated effluent. This is how big the real difference is in concentrations. This is important to keep in mind when we are ranking risks and prioritizing measures. So discharges of pharmaceuticals from use or from production differ on many points. And one aspect they don't differ on is that they are very rarely, if ever, regulated specifically. As said, discharges are, should be there, from excretion are more widespread than industrial discharges. And concentrations differ widely. This difference in concentration span also means that a lot more drugs can reach harmful concentrations at industrially polluted sites. Industrial discharges are often highly erratic, making them challenging to monitor and regulate. And while concentrations rarely differ more than about an order of magnitude between sewage effluents from different plants, differences can be much larger between manufacturing sites. And while there are hundreds and hundreds of studies on sewage effluents, there are only tens of studies on manufacturing plants. Discharges from usage are part of today's environmental risk assessment procedures in Europe, whereas this is not the case yet, at least, for manufacturing sites. And discharges from usage may affect the environment close to the user, which is not the case often for manufacturing discharges. So exporting environmental effects far away may limit the willingness to actually do something about the problem. Whereas society at large basically runs or pays for municipal sewage treatment, the manufacturers themselves can be seen as more directly in charge over industrial discharges. And finally, if you use a different brand or product with the same active ingredient, that doesn't matter for the concentrations that end up in sewage. Whereas for industrial emission, this difference can be huge. The problem is that we don't know which products are associated with good pollution control and which ones are not. So for human health, by far greatest concern is if antibiotic in the environment promotes the emergence and spread of antibiotic resistance. But actually, resistance to antibiotics, that's ancient in the external environment. These genes occur naturally at very low frequencies in environmental bacteria. But as long as they stay there, we don't have a problem. The problem starts when they are transferred to bacteria that cause disease. And that has happened several times in the past. This transfer of resistance is greatly facilitated by exposure to antibiotics. And the scary thing is that this in principle only need to happen once at one site on our planet. Then Pandora's box is opened, and the only thing we can do is to try to limit their spread. So where does this happen? Well, in the intestines of animals and humans, this is a likely place because we often have a lot of antibiotics. But the diversity in our intestines is limited, and so are the resistance genes. The diversity in the intestine fades into bleakness compared to the diversity out here. Out here we probably have resistance to every type of antibiotic that we will ever invent. And it's sufficient if it arises somewhere on Earth. If resistance reaches the intestinal flora, we can be pretty sure that it soon reaches the rest of the world. So we need to engage much more in antibiotic stewardship in other countries, as bacteria completely lack respect for national borders. How to best manage antibiotic pollution is one of the questions that we address in our recently started Center for Antibiotic Resistance Research at University of Gothenburg, CARE. It deals with pollution, environmental dimensions, but also with many other different aspects on antibiotic resistance. And I hope that this center may create opportunities for collaborations with many of you in the future. And to finish, I'd like to thank my group members on the pictures, my collaborators, some in the audience, funding agencies and the organizers, and you all for listening. Thank you.
Thank you, Joakim. Thank you very much for this broad overview, and not just touching the problem, the scope of the problem, but also pointing out already where the challenges to the solutions are. But if you, now just to, before I open to the audience, we have time for questions after every presentation, because not every speaker will be available for the panel debate in the afternoon, so we thought it's much more important to be able to ask questions directly. So if you, I mean, you just started your center, so you have a clear focus on the antibiotics right now, but generally in this scope, what's your wish list, your top priority, what's to be tackled here, and now that we have such a broad range of stakeholders here today?
Two things I'd like to see. One is to assess risks for antibiotic resistance development in the environmental risk assessment procedures. Second is to take into account the discharges from the entire life cycle into the environmental risk assessment procedures. Those are two wish points.
Great, thank you. We have a microphone somewhere, so welcome. Any kind of follow-up questions that you have? Not that many yet. I can start with another one, because some of the slides that you showed were several years ago, and was one of your students who contributed to the discovery there's a linkage between the production sites and the Swedish markets. And you've been personally engaged in the follow-up process, and are one of the researchers. This is also visible on this more administrative level. How much has happened? I mean, a lot has happened, but did you expect
Sweden,
that in the beginning?
in the world, in India, or what did you?
All of it.
All of it, okay. In India, in this particular place, they built a 20-kilometer long pipeline and rerouted the water to another river system. So that is the solution there. In Sweden, I think there's a lot of initiatives, and I think that we will hear much more about them later. So I don't want to steal time from Pauline. I think will be on the stage later on, and she'll talk about some of these. But I think that Sweden is driving this development a lot. I think we play a role as role models and leading the development in terms of this. So I think that even if we are a small country, I think we can make a bigger impact than what would be seen from our small size on this planet.
Okay, great. Anyone come up with a question? Otherwise, we just go on in the program. And
okay.
thank you, Joakim.
Thank you.